is how poor sleep habits can cause you to become diabetic if you're pre-diabetic or you don't even know. Hi, I'm the Fly Foot Doctor. I am a foot and ankle specialist, and I see a lot of diabetic patients and a lot of pre-diabetic patients. So I have just dedicated time to learn a lot more about pre-diabetes and how we can try to prevent ourselves from becoming diabetic if you've been diagnosed with pre-diabetes. Poor sleep habits can actually increase cortisol. Cortisol is a stress hormone that our body produces to try to manage stress. Now, unfortunately, cortisol over long periods of time actually affects how insulin works. And so if it's affecting how insulin works, insulin cannot get blood sugar or the sugars in our blood into the cells where they need to be. And so here we are walking around with high blood sugars, and over time, your body will then become insulin resistant. This is a much more complicated process, but I am just breaking it down as simple as possible. So cortisol could affect how insulin works, and over time your body could then become insulin resistant, so that you now have all this blood sugar floating around and nothing is there or available to be able to get this blood sugar or your sugar in the blood into the cells, ergo becoming diabetic because now you have excess blood sugar that is higher than normal. The next way that poor sleep can also affect us or kind of lead you to become diabetic if you're pre-diabetic is that while you're sleeping, your body is actually breaking down glucose. Insulin is working, it's breaking it down and is storing all of these glucose in the cells for when you need it. Sometimes what'll happen is if you're having poor sleep, insulin is not working appropriately. So now you have higher fasting glucose levels. Instead of your body to be using the glycogen storages that you were supposed to use, it now has this excess amount of sugar in your blood. So that leads to higher fasting glucose levels and then ultimately insulin resistance. Lack of sleep increases this hormone called ghrelin, which is the hunger hormone, and reduces leptin. Leptin is the fullness hormone, meaning the hormones that are supposed to tell you that you're full, stop eating, it reduces it. The one that tells you, yo, you're hungry, eat everything in sight, it increases that. Now you have cravings. Now you want sugar. And especially if you're sleepy and tired, what are we reaching for? High sugary drinks, drinks that are filled with caffeine. I know, I'm guilty of it too. So poor sleep makes you tired, increases this hormones, and makes you crave more, and we reach for things that are poor. That could ultimately tip you from becoming diabetic if you've been diagnosed with pre-diabetes. The next way that poor sleep can make you become diabetic if you're pre-diabetic is by chronic inflammation. Your body is in this constant state of chaos, and that affects insulin's productivity. It affects how insulin works. This chronic inflammation could damage the cells that produce insulin. So while you're having insulin resistance, you can then become insulin dependent, where you have to inject yourself with insulin. So ultimately, you want to put yourself in a state where you're not chronically inflamed. We talked about poor sleep increasing our cortisol, which is a stress hormone, and usually that allows for accumulation of fat, especially in the abdominal area. And we know that this visceral fat accumulation also could, studies have shown that it could lead to insulin resistance. And you've heard me say all of this all the time. Insulin resistance means you have insulin. It's just not enough. It's not working well enough. So now you just have this sugar that's flowing because the insulin is not working, and ultimately you may overwhelm your cells that produce insulin such that it's not even working anymore, and you may need to then have insulin injected into you. All in all, sleep is extremely important in managing things in our body. For chronic inflammation, I like to recommend turmeric. You can pick these up from Amazon. Check out my storefront, to kind of manage blood sugar control. I like cinnamon, apple cider vinegar. These are things that help to reduce gastric or stomach emptying. It helps to increase insulin resistance. So you can check some of the things that I've posted. They would really, really help. If you have any questions, leave them down below. If this is your first time here, thank you and welcome. Please subscribe. Share this video with friends and family. If you have any questions or suggestions, leave them down below. I appreciate you. Till next time, take care.